afternoon. It is 2:30. Welcome to Cook County Health Department Schools and COVID-19 Weekly Update. My name is Kelly Jones. I am a health educator senior with Cook County Health Department in the Community Engagement and Health Education Unit. I am your moderator for our weekly webinars. Let's get started. To review our objectives, we are here to support schools while navigating COVID-19 and answer any frequently asked questions, provide CCDPH contact information and resources. Few announcements. We just want to wish you all a happy holidays, whatever you celebrate, whether you celebrate or not, we wish you well. And as a reminder, we will be off on the 24th and the 31st, which is New Year's Eve and New Year's Day. We will be back on January 7th, and at the beginning of the new year, we will begin a bi-weekly schedule for our webinar. So we'll be back from the holiday break again, January 7th, and we'll start a bi-weekly schedule. You can still register in the same Eventbrite link that you have been using to access these webinars. Our webinars are recorded and they're uploaded to our YouTube page as well as our school's website. So please look at it at your leisure if you need to reference anything that we talked about in previous webinars. We start promptly at 2:30. Please make sure you keep your lines muted. We don't want to disturb any others' viewings with disruptions, and our chat will be disabled during our webinar and the presentation and turn back on for Q&A. If you have any questions and you need to reach us during the holiday break, please continue to use the emails that we have given. The general COVID email are for general questions that you may have. And then you can also report your line lists and you report communicable diseases and your metrics to the CCDPH _. email address and our other various resources if you need access to it. Please send all EpiPen requests to me, kjones1 at cookcountyhhs.org. Our doctor will supply you with a signed EpiPen standing order and prescription, and then you must fill that using the whatever mitigations your administration uses for filling prescriptions. Please make sure that all your requests are typed and then they come from a medical professional, i.e. your school nurse or someone who is trained in medication administration. We are able to provide PPEs to various organizations. You can complete the form on the slide. All of the slides will be sent to you, and we hope to fill most of your requests. I'm not sure the turnaround time. Someone asked me before the turnaround time for the request. I'm not sure, as I am not in charge of this, but I'm sure they're working very quickly to get that to you guys. We are interested in finding out your school vaccination information. So if you have a school vaccination program going on, please fill out the form because we'd like to just find out what's going on with schools and keep us abreast. Starting today and tomorrow, we are at Leak and Sons Funeral Repast Center doing COVID vaccinations in partnerships with other suburban funeral home owners, and they are also offering a $100 gift card and various other resources. If you need a ride, you can use the destination vaccination phone number in order to get a ride to that appointment. So that's just one thing that we are doing right now, but you can go to our Cook County calendar in order to see the events that are coming up. And this is just a little screenshot of what we have coming up within the next week. Also, if you are interested in having a Cook County Schools clinic, you can please contact the information that is on the slides and they will help you to set that up. And here's just some resources if you would like to host a clinic, and it's just some tips in hosting your best clinic. So there's downloadable information and some tips on how to host a good vaccination event. There's other educational resources that may be downloaded from our website. And if you're interested in checking out our My Shot campaign information on our YouTube page, they also promoted some videos using kids as they were getting their vaccinations. So please check that out. More downloadable information. Again, if there's a testing program that you guys have, we want to know what's going on within the community and how we can help. So please fill out that link. And if you're interested in getting the rapid antigen binest test, please use the link to contact us. I know there's been some confusion about expiration dates, but if you have any questions, please feel free to reach out to us and we'll make sure we can answer those questions about that.
Excuse me, Kelly.
Sure.
Deidre, I'm sorry, I sent you a note. I just wanted to just chime in about the Binex test.
Go ahead.
Given the holiday coming up and break coming up, we're asking if people have orders for by next that they please make those orders no later than 12/17/2021. So by 12/17, if you have a by next order that you would want filled this year, please complete those by 12/17. And I think the latest pickup is 12/22. So please, if you are in need of Binex tests, please place those orders by 12/17, close of business. After 12/17, we will not be taking any new orders until January the 4th.
That's good to know. Thanks, Deidre. I didn't see your note. Thanks for that information. Any other announcements before I go to the?
No, sorry, that's all I
No,
had.
it's okay. I'm
You
glad you
can get
chimed
it
in. I didn't.
in before you get, and I know people are everybody's preparing for break, but if
Sure.
people want to order, they need to order by again 12/17/2021. After that, we'll be shutting down orders until January 4th, 2022.
That's
Thank
great
you.
information. Thank you, Deidre. And if you also like to set up shield testing with your organization, you can email the following email address, and the people over at IDPH and Beth Heller can set you up with shield testing. If you're interested in having a speaker come to your organization to talk about COVID related issues, you can fill out the information at the Google Doc. It'll ask you a few demographic questions to try to set you up with the most appropriate speaker for your event. Again, we mentioned the Destination Vaccination Rides program. You can call the 833-308-1988 number in order to schedule a ride, and they will pick you up and drop you back off at home. You can also call the same number for in-home vaccinations. The in-home vaccinations are barring people who live in the city, Skokie, Evanston, Oak Park, and Stickney. However, you can use the Destination Vaccine Rides program throughout any jurisdiction, including the city of Chicago. And here's a few more resources you can feel free to look at your leisure. And I will stop sharing and toss it over to Lex. Hey, Lex.
Okay, so today we've got the usual housekeeping, metrics updates, travel updates. Just want to give you guys a little bit more context about Omicron, go over home tests again, and then some reminders about sports and quarantine, and then just a couple of submitted questions. So as you guys have been doing, keep emailing CCDPH schools. Remember that if it's not an urgent outbreak situation, we should be responding within 48 hours. Unless it's, the weekend or something, then it'll be Monday. But just keep that in mind. And again, since different people answer different things in the emails, if you could be really specific in your subject field, that would be super helpful. So if you're reporting an outbreak, make sure outbreak is in the subject line. If you're asking for guidance, make sure guidance is in the subject line. If you're reporting a case or close contact, have case or close contacts and reporting in the subject line. Straightforward. A lot of you are doing it already. It makes our lives just a lot easier because we all handle different topics within that email. All right, so jumping into metrics, we have massively spiked, you guys. We are at the same level where we were last year, except last year, our huge winter spike, it was above everybody, but it was largely in older children to young adults. Now we are seeing our huge spike at the same levels as last year in these older age groups in our 5 to 11 elementary school age groups. As you can see here from this IDPH graph, we are much higher than we were. And from our own graph, our CCDPH graph, we've really increased since Thanksgiving. We're seeing a lot of this is from the Thanksgiving holiday. But at the same time, again, I still have to applaud you guys. 75% of the youth in Cook County have at least one dose, which is really a great vaccination rate. Obviously, we want to get that up as much as possible, but that is really encouraging. And a lot of the questions we've been getting are about people who are between doses or waiting to be fully vaccinated that 2 weeks after their last dose. So that, again, really encouraging to see that vaccination rate. We have jumped in 1 week over 100 cases per 100,000 population. in a week's time, which is a huge jump. We are in very high levels of community transmission, about where we were last year. The positivity rate is around the same, and the percent of the total population with a completed vaccine series about the same, and kind of same for outbreaks. There's 163 in the state, and 48 of those are in our jurisdiction, in suburban Cook. So we're about where we were in some aspects, but we've massively leaped in terms of case rates. For travel, basically, we've still just got the Gulf Coast states, California, Hawaii, some of the territories, but basically these southern states that share a border with us, Kentucky, a little, then Tennessee, Missouri, Arkansas, these have all gone back to orange. So that's something to keep in mind if you've got students you think are going to be traveling or seeing family in those surrounding states. We're kind of seeing a big Midwestern spike, especially. So I think a lot of us have family in surrounding Midwestern states. That's something to keep in mind. We would be considered very orange. If there was red, maybe red. But yeah, we're up there with everybody. As a reminder, this hasn't changed from last week, but for people who are domestically traveling, vaccinated individuals just have to monitor their symptoms for 14 days. It's a good idea to get tested like 5-ish days after you return. It's not required, but it's definitely a good idea. And then for unvaccinated individuals, especially those who are going into orange labeled states, it's not a great idea to travel, but if travel is unavoidable, then they should get tested 3 to 5 days after they return to Cook County, and they should be staying home while they're waiting for those test results and then even after they get the test results, if it's before 7 days, they should stay home the full 7 days. If they decide testing isn't for them, then they should be staying home for 10 days. That is in general. For students, we're going to allow them to return to school while they wait for those test results, but if they're returning to school, they really should get tested upon returning. And as has been the case this whole time, everybody should be monitoring their symptoms for the full 14 days, whether they're vaccinated or not. If there has been any potential for exposure, just be keeping an eye on how you feel. For international travel, if you've got families you think might be participating in that, vaccinated is obviously the way to go for that in a big way. And it's absolutely not recommended for unvaccinated students to be traveling internationally. But again, if it's unavoidable, everybody, including vaccinated people, will have a negative test result within 1 day of arrival. So that's one good safety measure that's in place for everybody. Then when you've got students returning, if you're vaccinated, go back to school, get tested, self-monitor your symptoms. But if you're unvaccinated, same thing. As if you were unvaccinated traveling in some of these orange areas, you should be waiting to return for about 7 days. And as always, self-monitoring your symptoms. All right, so Omicron has obviously been in the news a lot, and I wanted to give you guys some actionable context for some of the headlines you might be seeing. So it is already circulating in our area. We're seeing an increase in some breakthrough cases, not dramatically, it's nothing to be really concerned about, but we are seeing an increase, and we can't say for sure whether that's from Omicron or not, but it's here, and Delta is still hugely what's circulating, but Omicron is here. There's evidence from several sources, but with the caveat that it hasn't been peer-reviewed yet, that have shown significant reduction in our antibodies ability, whether that's from vaccination or from a natural previous infection. That ability to neutralize the virus has decreased. There's mutations that basically allow it to swat away the antibodies trying to hook onto it. So they're from several different countries. They have shown this in samples from people who have been infected. So something to keep an eye on, that it's got that immune evading quality to it. But 2 doses of Pfizer vaccine, and we don't know about the others just because they haven't released data yet, but Pfizer announced that 2 doses have been effective in reducing the disease severity, hospitalization, and death, so that is great. And then if you've had 2 doses, now is the time to get a booster, because they have preliminary results that say that that 3rd booster prevents general infection from Omicron too, not just, making sure you don't get super sick, have a severe case or anything like that, but it prevents infection in general. So that's really promising. And then also promising is that Omicron does not appear to be more severe than previous variants. It might be able to spread easier and it might be able to infect easier, but people aren't feeling sicker than they did with previous variants. So it's not something to panic about. It's just something to prepare for and deal with, as we have been dealing with everything so far. And then if you wanted to do more reading, I've linked all the studies if you wanted to read up on those. Home test, this is exactly the same as last week, but we've still been getting a lot of questions, so I wanted to go over it one more time. If you get a negative at-home test results, that can't shorten quarantine for somebody or exempt them from quarantine if they've had close contact with a case. It's also not acceptable for travel requirements. If you have a positive, the first thing I'm going to say is it's recommended to get a confirmatory lab-based test. If that test result ends up being negative, and it's happened pretty quickly after that home positive within 48 hours, then we're going to use that lab-based test to make decisions. So if it's negative, we're going to allow that person to return to school as long as their symptoms have resolved and they feel up to it. If they don't get a confirmatory negative test, then we have to treat them like a positive person. So that means they're going to have to isolate for 10 days. That means you're going to have to contact trace for them, the whole 9 yards, as you usually would. So home tests are considered probable cases if they have symptoms and are a known close contact only. So again, without that confirmatory testing, we're just considering this person as a case. We're going to act as if they had a positive from a more accurate test, just because we don't know for sure from that confirmatory test. So that's what's up with home testing. There's really good resources from the CDC that also has videos on how to administer a home test. I helped my brother administer a home test this week. It doesn't feel like the PCR where they're going up so far back into your head. Super easy to do, very easy instructions. And CDC has good resources. All right, so none of this is new information, but it is what I really wanted to highlight, having been responding to some of the guidance emails now. IDPH, and this is bold for a reason, you guys, IDPH is recommending that youth participants who are not fully vaccinated get tested at least twice a week, regardless of what sport it is, and preferably within 2 days of competition. We are seeing a lot of sports-related transmission, especially in wrestling. This is really essential for those sports where it's not safe to wear a mask if you're competing, so masks aren't worn during competition, but they really need to be tested twice a week to make that safe. We've got a lot of outbreaks, and obviously because you're competing against other schools, it can jump school to school then because of that. So it's really important to at least be testing your athletes really thoroughly. And then I do want to add that if a sports team is in an outbreak situation, whether that's an outbreak on the team or like half of the class is in AP biology and there was an outbreak in the classroom, they can't compete against other schools. It's not allowed. What they can do is mask and distance with their teammates, and they can train amongst themselves, scrimmage in a non-contact way if it's a contact sport. So there are options to, keep up their physicality, but they cannot compete against other schools in an outbreak situation. So 2 really important things to emphasize there with sports. And then just, we've had some complaints this week about a lot of from parents saying that it's rumored that there are kids who tested positive but are still in school sitting next to their student, or people who are supposed to be quarantining are coming into the school to collect their homework for the day or a textbook or things like that. So I wanted to emphasize that if a student is in quarantine or isolation, they cannot enter the building to collect assignments, to play sports, do other extracurriculars. That is not allowed and not the point of quarantine. They should be virtually learning to the greatest extent possible. All the things they need to be given virtually, excuse me, but if physical copies are absolutely necessary, then they need to be picked up or dropped off outside of the school, whether that's left in their mailbox or in a box outside the school for them to collect, or sent home with a friend or a sibling. That's how it should be dealt with. They should not be invited into the school, into the classroom to collect their work. That is not a good idea. And then follow up to that, students who are quarantining should not be seeing each other while they're being excluded. So, as an example, if the basketball team needs to quarantine, the basketball team should not just be hanging out in someone's basement all together. They shouldn't be practicing in someone's really nice, like, sport court in the backyard all together. They shouldn't be doing homework or virtual learning together. They shouldn't be attending worship together, going to religious education together. They shouldn't be attending things all together, even if they are quarantining, because it's possible one of them ends up developing symptoms and is infectious and another person doesn't, but now they're going to catch it from that other close contact. So, something obviously the school doesn't have that much control over, but is good to remind, coaches to teams or things like that. There shouldn't be, carbo loading pasta dinners when the team is in outbreak mode. I think that's common sense, but we have been hearing some issues with this. So I wanted to reiterate that those are really important to follow. All right, then I think we had 3 submitted questions. So first one, is IDPH going to recommend an adaptive pause after the holidays? I don't need to give you the background to that, and we are at a similar transmission level as we were last year, but we have access to the vaccine this year. So an overall pause isn't going to be recommended for everybody in general. We want to keep kids in school as much as possible, but you can make the decisions that seem right for your school. If you think you've got a lot of students who are going to be traveling, you can decide that you want to take that adaptive pause, or maybe you don't have the resources to keep up with any kind of potential holiday related surge. You have to decide what you guys are capable of handling. You can also see how it goes that first week, and if it gets overwhelming, take a pause. So there will not be an overall adaptive pause recommended, but play it by ear and do what's right for your school. If you're seeing massive spikes and need to close classrooms or things like that, we will be keeping in touch with you after the break and helping guide you through that if those situations arise. And I just want to, not that this is a common thing, but I do want to remind people that some families do take advantage of that extended break in their minds and not an adaptive pause and just stay at their travel destination for another week and potentially get exposed. So that is something that has happened last year, led to spread. So just something to keep an eye on. All right, second question. Some parents of unvaccinated students are pushing back, claiming that we are discriminating against their children by requiring their children to fulfill one of the quarantine requirements, either test to stay or quarantine at home. Their primary argument is that vaccinated students can become infected and transmit COVID just like non-vaccinated individuals. And because I read that sentence, I just want to say that's not true. So I'll address that in a second. But the questions are, how should we respond to this? And then, do you think guidelines will change in the future to reflect, what's going on with Delta and Omicron? So first, I want to say that main argument is mostly false. It's technically possible for a vaccinated person to become infected and transmit the virus. It isn't just like non-vaccinated individuals. It's day and night with these two situations. the likelihood of becoming infected is so much lower when you're vaccinated than an unvaccinated individual. And studies have shown that in most cases, less virus ends up being shed by vaccinated individuals. We'll see if Omicron changes that because of its affinity to better attach to human respiratory cells, but we don't have any evidence of that yet. So this means that the students' and families' informed decision to be vaccinated is protective of the school community, and they pose a significantly lower risk to the school community after exposure to a case. That's why these are completely different situations. It's not discrimination in any way, shape, or form. It's about public safety and public health. In the first place, obviously you guys know since you're working in school public health, but obviously students don't get to come to school if they're unvaccinated for our core childhood vaccinations unless they've got a medical contraindication. So it's really the same thing. It's laws and courts have historically upheld vaccination requirements in schools because of the danger that disease can pose to the school community, and we can't take away other people's right to education because of personal beliefs and choices. It's against the law to have your individual beliefs and choices infringe on someone else's health and safety. So it's a very different situation. If you're asking how I would respond, maybe leave the legality part out of it, but say, talk about the science. Someone who is vaccinated is significantly a lower risk to the school community, a much lower risk than causing an outbreak in the school community than an unvaccinated person. So that, because vaccinated people pose that significantly lower risk, they're always going to have more freedom after an exposure to a COVID case than an unvaccinated person. I don't know, I can't say for sure whether guidelines will change. It may be that following exposure to a case, a vaccinated person will be required to get tested. Right now, it's just a really, really strong suggestion. So I could see that happening, but I don't think there's going to be very big differences in terms of quarantine options. So hopefully that answers your question. If you go back a couple of webinars, I've got some good studies if you want to read through them on the safety and efficacy of vaccines for young adults and children. So you can always feel free to go through that literature or share that literature if you would like. All right, last question. Are vaccinated asymptomatic individuals who have been in close contact with multiple household members who have tested positive required to quarantine if they are able to self-isolate themselves from the positive cases? And there's a couple of key things here. They're vaccinated, they're asymptomatic, and they're able to isolate from the cases. So no, they can keep going to school. They should be tested on day 5 to 7 after the last exposure that they've had to those cases. And of course, as always, monitor their symptoms for the full 14 days. But no, they can keep going to school. If they start to feel sick, that's immediate isolation. But we don't want to keep somebody out of school for too long when they've got household cases, especially when they've been vaccinated themselves. Okay, sorry that took a little bit, but that is everything I've got. I've got the usual references here for you. Test to stay, test results in substantial transmission, what tests are acceptable for return to school, the SHIELD FAQs, things like that are all in here that will be disseminated to you guys after this. And with that, I will stop sharing my screen and take a look at the Q&A. Is there any guidance about canceling competitions if there is an outbreak on a sports team? For example, if a team of 50 wrestlers has 3 positive cases and 15 others are deemed close contacts, will we just wait for guidance from the local health department to determine if the remaining athletes should be continuing to compete against other schools? Amy, I think you answered your own question. Yes. We, especially with like wrestling, we need to take a close look and see if there was maybe close contact that hasn't been identified yet and other things like that. So we work closely on that. I know competitions can be important, so we'll talk to you guys about that if that situation arises. All right. A colleague asked me this question, and I wanted to hear your thoughts. According to the CDC, the EUA for the current PCR test will be revoked. Oh, sorry, hang on. I'm getting a spam call. Let me turn my phone off there. For the current PCR test will be revoked. What does this mean for our testing going forward? I haven't heard about that. Let me open the link on my own computer and take a peek. I will look
Do you
at
need me
that.
to take that, Lex?
Oh yeah, go ahead, Michelle.
So I actually wasn't sure when it was happened, but whenever the EUA would be revoked, it means that all the tests that would be accepted would have to be FDA approved. And I assume there would be a different set of tests that would be FDA approved. And hopefully it's not gonna be too hard on us or the school community to determine which tests are no longer usable.
Next question. If a student does test to stay for 7 days, they should be out of sports for 14 days. What about those students who refuse test to stay and isolate for 10 days and return on day 10? Just confirming they should also be out of competitions until day 14 as well. Yes, so anytime a shortened quarantine is taken, they still need to be masked and distanced during anything school related, including extracurriculars. So they shouldn't be in competitions against other schools, but if the team can find other ways for them to participate while wearing a mask and distancing, it's totally fine for them to still be participating in that way, whether that's like setting up drills but staying away from individuals, or like working out in the workout room away from everybody while they're scrimmaging. Those are all options, but they should not be playing in games or competitions. I have several parents who are challenging positive Shield results as false positives. They have submitted a negative PCR test to combat this. Does that allow Shield to be overturned? Michelle, we've gotten this question a million times this week. Would you like to answer it?
Generally speaking, no. Not unless there's an infectious disease doctor that would be able to provide us a note with it. But generally speaking, Shield will pick up a COVID positive sooner than the other tests. And I think IDPH presented this research to us in one of their webinars before. Shield will also pick it up a lot longer compared to the other tests. So if you have someone that was previously positive, it's very common to see a positive Shield with a negative antigen and a negative PCR with some of the other tests. So it actually go both way, and because we do not know which way it will swing, it's just safest to, make sure we do the isolation and quarantine.
Yeah, I also want to add, like, having been a student of many infectious disease physicians, the chances of them overturning a lab result are very slim. If a lab result gets overturned, that's usually due to some kind of testing error or error at the lab. So I just wanted to mention that. The next question, if a student has been absent 5 days and did not test until day 5 and received a positive result at that time, how should the school proceed with contact tracing? And I think the detail we need here would be when did their symptoms start? So if their symptoms started when they started being absent, then you need to contact trace from 2 days before they started being absent, because that's when the symptoms started. If they've just been absent for 5 days because they decided to go camping in Wisconsin or something, then that's a different story, and that positive results, going backwards, they haven't had contact. So it depends on whether they've had symptoms or not. So just base your decision off of the symptoms. All right, a follow-up question on Shield false positives. Is there a process by which someone can be cleared for an early release from isolation if they believe it was a false positive and have negative nasal PCRs? Also, a CCDPH contact tracer told the family that the efficacy is not great of the Shield test and nasal PCRs are more reliable. They're not more reliable. Michelle, do you want to just repeat what you just said one more time for everybody?
I would not say, so Shield and the nasal PCR, they are both lab-based PCR tests. Shield is a very good test, and we are finding out that we are able to pick up COVID sooner with saliva-based tests compared to nasal-based tests. But keep in mind, nasal is still our gold standard for testing. And Shield is definitely a little bit less invasive. Shield does, I believe, like a 3-gene matching. If someone tests positive for Shield, they have some kind of COVID DNA in their system somehow. Now, it could be so little that it might not even cause an infection because a PCR test does amplify RNA. So someone in the household could be positive. They might have some COVID RDN in their nose, and it might not be enough to trigger an infection. But those people will test positive. But I might be going too deep into testing.
But to answer that first question, is there a process to be released from isolation early? Only if the original lab result is overturned to be negative, due to a testing or lab error, or whether those results are reviewed by an infectious disease doctor and declared invalid. Those are the only situations where someone could leave isolation early at this point. I haven't seen any questions for a couple of minutes, so I'll toss it back to you, Kelly, and we'll answer anything else that comes in.
I just wanted to ask Deidre to reiterate the Binex update for those who join later and see if there's any other updates that we have. Maybe Deidre had to hop off. But for those who weren't on before, Deidre made an announcement saying that anyone who wants to order the Binex testing, please make sure you do that. I believe she said by the 17th in order to get that filled before the new year, because they will be taking a break at the new year and they will not be filling tests again until, I believe, January 4th. So please keep that in mind if you are interested in ordering Binex from Cook County Health Department. Also, we will not be having our webinar on the 24th and the 31st for the holidays. We'll return on January 7th. And after the first of the year, we will switch to a bi-weekly format. So if there aren't any more questions, I'll let me know what's going on in the chat. I see a few more questions just popped up. Is there a status update? You can contact Vanessa. Is there a status update on the anything placed November? That probably should have been filled. So you can send us an email and then we can get that status to you, but that should have been filled by now. That's over a month ago, almost.
I don't see any more questions, but I do want to mention as a follow-up to the Binax, we're no longer in short supply of those tests, so there's no longer a need to use expired tests. So if you are hoping to get more tests, put your orders in. You don't have to use those expired ones. I just wanted to mention that because we've gotten a few emails asking for that list of expiration dates this week.
Okay, last chance for questions. If not, you guys enjoy. How do we dispose of expired tests? That's a great question.
Michelle, you want to take this one?
I don't believe there's any special protocols we have to do for test disposal because there's no specimen on the new test. I will ask CCDPH and get back to you, but I don't believe there is any special requirements for disposal of expired tests.
Great, thanks. That's a great question. So we will adjourn for today, and you guys have a great weekend, and the slides will be sent out to you. And take care, be well, have a great weekend. Thank you.